Gestational diabetes is one of several conditions that can complicate a pregnancy. According to the American Diabetes Association, almost 10% of pregnant women who did not have diabetes before pregnancy will be diagnosed with gestational diabetes. Gestational diabetes occurs when a woman's body can't make enough insulin during pregnancy to compensate for her natural hormonal changes. According to the National Institute of Diabetes and Digestive and Kidney Diseases, several things can cause a pregnant woman's chances for developing gestational diabetes, including obesity and being overweight. Additionally, women who gain weight quickly during pregnancy may develop the condition. And unfortunately, women previously diagnosed with gestational diabetes in past pregnancies have a significant chance of developing it again each time they become pregnant. Giving birth to a baby that weighs more than 9 pounds or experiencing a stillbirth may also increase the chances of gestational diabetes. Also, certain other health conditions may increase the risk for gestational diabetes, such as polycystic ovary syndrome. Other risk factors include having immediate family members with type 2 diabetes, being over 25 years old when the pregnancy starts, or being diagnosed with prediabetes before the pregnancy. Also, some races, including African Americans, Hispanics, Native Americans, and Pacific Islanders, have higher rates of developing gestational diabetes. Signs and symptoms of the condition can vary between women. Some telltale minor signs of the condition include increased thirst and more frequent urination, blurred vision, unexplained weight loss despite eating plenty of food, and yeast infections are other symptoms. There can be more significant signs and symptoms like fatigue, nausea, and vomiting, but these conditions can also be present in women who don't have gestational diabetes. In fact, some women experience only barely noticeable symptoms when they have gestational diabetes, which makes it vital for prenatal care to include a blood test that checks for the disease. Testing for gestational diabetes is important even if a woman isn't at greater risk because she is a healthy weight, doesn't have a family history of the condition, and maintains a healthy diet. Ignoring the problem may result in health complications during pregnancy or birth. Because the condition tends to develop in the middle of pregnancy, women's healthcare teams usually perform this test between 24 and 28 weeks. For the mother, gestational diabetes may cause preeclampsia, premature delivery, and high blood pressure. They also have an increased risk for cardiovascular disease, cancer, or chronic kidney disease in the years after pregnancy. This condition not only affects the mother's health, but can also affect the developing baby. Short-term effects include low blood sugar at the time of birth, breathing problems, jaundice, and a low calcium level. Also, according to the CDC, poorly controlled diabetes may result in a baby growing exceptionally large due to excessive feeding while the baby is in utero. This creates additional concern as large babies delivered vaginally have a higher risk of nerve damage from added pressure on the baby's shoulders during birth. In fact, a large baby may require a C-section for delivery. A cesarean birth usually means additional recovery time for the mother. Children born of mothers with gestational diabetes may also suffer from obesity, altered neurocognitive development, and insulin resistance. After diagnosis of gestational diabetes, rather than trying to reverse it, the main goal is to manage the disease and maintain a healthy pregnancy. Gestational diabetes care doesn't necessarily require insulin shots. Many women can deal with the condition solely through diet and exercise. The risk of complications during pregnancy can be reduced by regular testing of blood sugar levels. Exercising regularly also becomes important. According to a Harvard Health Publishing article, physical activity helps lower blood glucose levels and improve insulin sensitivity. Walking at least 4 hours a week is linked to a 40% lower risk of heart disease. In addition to exercise, adopting a healthy diet, which includes the right balance of protein, carbohydrates, and fats, may lower pregnancy complications. Healthy food not only provides the best nutrition for the fetus, but also helps women maintain a healthy weight gain during pregnancy. Creating a list of healthy, simple foods to eat will help avoid blood sugar spikes and diabetic complications. All of this makes it essential for pregnant women at risk for gestational diabetes to stay in communication with their doctor and develop healthy eating and exercise plans to reduce the chances of complications. On the positive side, pregnant women diagnosed with gestational diabetes usually see the condition disappear after they give birth and their blood sugar levels return to normal. Also, most women can experience otherwise normal pregnancies despite the diagnosis. Gestational diabetes is manageable, especially if diagnosed in time and properly treated. The more you know, the better prepared you can be. Keep in mind that you're not alone. You can learn more about causes, treatments, family forums, parent support groups, and more at birthinjurycenter.org. The Birth Injury Center is here to assist you, offering consultations and abundant resources available to help you learn more. For your own peace of mind, please visit birthinjurycenter.org.